is me, but if it's not me, then I'm not going to.
Okay.
And so, Kim, I am very glad that you've turned the mic over to me because I'm going to commandeer it for a couple of minutes. We are so sorry to hear that you're leaving. There's been a groundswell of secret organizing, such as it is, you know, in COVID times. And so I'm going to pin your video so I can see you a little bit better here. So, as you know, this is a big Kim fan club here. I feel like a newcomer to the partnership, but I've definitely heard the words of appreciation. And Michael is trying to join in. He's having some challenges on the road. So if he joins in, then he'll have a minute also. And so we really wanted to recognize your leadership, recognize your dedication, the energy that you've put into the partnership, and so much that I've seen, just the way that you really show your love. You come to these meetings, nights, weekends, whatever it takes. And so I've seen a lot of that just as I've joined. And so a couple of things.
I think you broke up.
Yeah,
lost Megan.
bad timing. Huh?
Megan's frozen.
Future, we'll have a chance to all be together and share a slice of cake, even if it's in the park. Oops, my internet's going. In the meantime, people are getting together a gift for you. And what the sort of consensus was that we would gather donations for a charity or cause of your choice. And so those have been pouring in. And so if you want to let me know at some time where you might like to send some donations, I can do that. And then if everyone could turn on your cameras for a moment. And I know my bandwidth is challenged, but if you can turn on your cameras,
we
have two more things. The first thing is, I'm going to count to 3 in a second, and you'll see what that's all about. And that if people don't have something physical, then you can make a face and wave your hands. And then the second thing is Michael Swisher has a further organizing point that he can make if he's already on and he has to leave, I know, at 6:30. Okay, so everybody switch to gallery view. All right, 1, 2, 3.
Yay.
So this is words of appreciation for Kim. If somebody can take a picture of the screen and put your hands in the air if you don't have a sign.
I just did. So wait, let me get page 2 so that I can see, so that I can have this framed and put up in my new space wherever that might be. Thank you very, very much.
And then Michael, did you have a last coda to put on to our short appreciation? If you're on. And if he's not on.
I'm trying to unmute. Can you hear me?
Oh, Michael. Yes, great.
Okay, it's very unstable, my internet. I'm trying to do it through my phone, through my Wi-Fi hotspot. But two words that I have to describe Kim are compassionate and culturally competent. I wanted to give a third one. I know we were trying to limit to 2 because it's just hard to limit to 2 words or even 3 with Kim. But another word that stands out is a true virtue of hers, which is committed, or she's very committed. And I just wanted to let you know, you've been a great mentor to me, and I'm very appreciative of everything you've done, and anything that you bring to our attention, please feel free that we're here to listen. Even though you're taking this another position, and I do I'm very happy for you, but we definitely will miss you. Okay, and that's love from me as well as all of us. Okay, thank you.
And then I'll just. Sorry to interrupt you, Michael. I'll turn it back. But Michael Swisher is also going to be circulating in our secret group email. He'll be circulating an opportunity for people to put a few words down in writing. So, all right, Kim, back to you.
super secret. Thank you all very much. And we can share more at the end of the meeting when when we have more time, because there's a lot of things on the agenda. I thought that it looks like we have lots of guests, which is lovely. So we'll do a quick, I'm going to do the popcorn. I'm going to call on you, say who you are, and just introduce yourself really quick. So I'm going to go in some sort of order that I have here. Grace. And you have to remember to unmute yourself. Oh, maybe Grace isn't
I
here.
mean, I was not prepared to be first. I thought
I
you
know.
were
I'm
popcorn.
forgetting everything.
Hi, I'm Grace. I am the new data specialist with APS and the partnership. I've met some of you. I will continue to meet more of you as as I continue in this role. I'm very excited. Definitely been a fun 2 weeks, getting to know all of these wonderful pieces of data that we have and that we still need to gather and how we use them and
Well, we're
all
gonna
the fun
hear from
things.
you more later. This is just the quick intro.
Oh, I'm so sorry.
Yeah, that's okay. Trini,
I was confused.
that's okay. Trini.
Hi.
Hi, I'm Trini. I'm the co-chair of the Healthy Relationships Task Force on the Arlington Teen Network Board.
Rick.
I'm Rick Strobeck. I'm the Deputy Director of Court Services.
Jamie.
Good evening, Jamie Premdash, Children's Behavioral Health Bureau Chief.
Ben.
Hello, everyone. I'm Ben. I'm a community member, APS graduate. And thank you, Kim. I'm going to miss you.
Christina.
Hi, everybody. Cristina Diaz Torres. I am one of the 2 new Arlington School Board members.
Lynn.
Hello, everyone. This is Lynn Ngay, Prevention Director with DHS.
Judy.
I'm Judy Haddon, and I'm a community member of the partnership.
John.
John Andelin, community member, also with the Community Foundation.
Dave.
Dave Carlson, I'm a community member.
Devanshi.
Devanshi Patel, community member.
Laura.
Hello, everyone. Laura Newton, APS, Director, Student Services.
Tabitha.
Hello, everyone. Tabitha Kelly, Child and Family Services, Division Chief.
Deborah.
Hi, everyone. I'm Deborah Warren. I'm the Deputy Director of Human Services.
Linda.
Linda Henderson, former partnership member, and I work with Second Chance.
Ann O'Brien.
Ann O'Brien, community member.
Aaron.
Hello, Arron Gregory, Chief Diversity, Equity, Inclusion Officer for Arlington Public Schools. Nice seeing everyone.
Mary Wolf. Hi, Mary.
Mary Wolf, community member, former APCYF, and super fan of Kim.
Jeannette.
Hi, good evening, everyone. Jeannette Allen, Interim Assistant Superintendent, Administrative Services with Arlington Public Schools.
Alicia.
Hi, everyone. Alicia Guajardo. I'm a community member and co-chair of the Youth Mental Health and Wellness Committee.
Michael Brown.
Good evening, Michael Brown, community member.
Kimberly Baldini. There's a few of us now.
Kimberly Baldini, Youth Services Section Leader, DPR.
Anita.
Hi, this is Anita Friedman. I'm the Director of Arlington County's Department of Human Services.
Colton.
Hi, everybody. Colton Gibbons here. I'm a community member as well as Kim's trustee partner for dialogues on race and equity.
Yes. Anne Marie.
Hi, Anne Marie Douglas, community member.
Let's see. Where did I just go? Michael Swisher.
Oops. Michael Swisher, I guess, community member.
Yeah.
Former staff with the partnership.
Barbara, we're just introducing ourselves really quick. You have to unmute. We'll come back to you. Rebecca, hi.
Hi, Mary stole my speech. I am a former staff member here as a member of Kim's fan club and current community member.
Rachel.
Hi, I'm Rachel Harlan and I'm with Libraries.
And Rachel has her own announcement.
That's right. I am retiring on August 9th.
So that's exciting. We've got a little bit of time with you though.
Yeah.
Lisa's iPhone. Is that Lisa Kaplowitz?
Yeah,
Yep,
it's Lisa Kaplowitz, Arlington Public Health.
Okay. Now, Barbara, are you unmuted? Okay, that's Barbara Gomez, and she's awesome, and she's a former chair and member of the partnership. And then Sally.
Sally Levante, web coordinator for the partnership and Team Network Board.
And Siobhan.
Hi, Siobhan Grayson, Child and Family Services Management Analyst, staff of the partnership, Team Network Board, and now a wandering staff member and president of Kim's fan club.
And I know that, did I miss anybody? I hope I didn't miss anyone. So it is Black History Month, and Devanshi and her Center for Child and Family Advocacy has been doing some really amazing mailings. And so I thought I would give the floor to her for no more than 5 minutes just to talk about these. And how many people have been getting the emails? Is there a show of hands? They're really, really wonderful. And so I wanted to say thank you for doing that. And if you wanted to talk a little bit more about that really quick.
Thank you. I promise I won't take more than 2 minutes, actually. So Center for Youth and Family Advocacy, known as CYFA, has been celebrating Black History Month all month long. And we have been engaging in an equity challenge called the Then and Now Personal Equity Challenge. So what we endeavored to do was highlight a person who has made history, and that person would be a Black man or Black woman who has contributed to the fabric of our community. We've highlighted people from Dr. Jemison to today's highlight is JML Langston. And every day there is a briefing that is sent to your email, which includes the spotlight on the individual and then a personal equity challenge. Today's equity challenge, I'll give it away, is Black music and the movement. And so, things that, other issues I've talked about: systemic racism, health disparities, educational disparities, criminal justice disparities, and need reform. And so every day we have curated different materials to be able to provide for people to read, watch, listen, and then reflect upon and answer questions. These are great opportunities to be able to work with other people and form your own group for discussion. And then discussions also carry over into our monthly conversations called Relax, Relate, and Restore. So if you're not already getting our briefings, again, there's one every day. So we've got 24 of them that are packaged now. Please just drop your email in the chat and I can send you the bulk of them. And then you can continue with us for the next 4 days. How was that, Kim?
That was
minutes?
Awesome. I loved it. Very good.
Thanks, guys.
Yep. Thank you for doing that. I have really appreciated being able to read those things. Okay, so now on the agenda, we have somebody from APS. So I don't know who wants to go first, Jeannette or Aaron. Aaron gave an amazing presentation earlier today, and I asked him if he wouldn't mind doing a similar presentation. So unless I see Jeannette jumping up and down wanting to go first, I can turn it over to Aaron. Okay, Aaron, I'm going to go ahead and share my screen and pull up your presentation.
Sounds good. How much time do I have, Kim, so I know how to?
if you can do like 15 minutes and then we have plenty of time for Q&A, that would be great. But it's, if you need more time, we can woodge around different things. We've got a little bit of flexibility here.
All right, sounds good. So nice to see everyone. And, you know, when Kim asked me to do something, I never say no. So I wanted to make sure that I was here with you all today and just kind of talk a little bit about APS and some of the great things, initiatives we have going on around diversity, equity, and inclusion work. Equity, again, is a strategic imperative for our work. I think they become even more apparent now as we're, you know, as we're managing this pandemic. Next slide. And again, Happy History Month, Black History Month. And I always bring up, you know, the father of Black history. And I know Patel probably knows a little bit about this, but, you know, those who have no record of what their forebears have accomplished lose the inspiration from which come from the teaching and the biography and history. So we want to make sure, as we're talking about Black history, that we're being purposeful and intentional with what it is that we're teaching. We're teaching true and authentic history. So happy Black History Month. And I want to also say that, I don't know if many of you know, but the month of March is actually by the governor or ordinance and via, I think it's the Virginia State Bar Association, not Bar Association, sorry. The school board has announced that Equity Month is going to be for the month of March. So let's continue to move forward with equity as just more than just a mindset and more than just a month, but to continue to, you know, to look at our diversity of all and inclusivity of all of the inclusivity of, you know, all of our students and all of our families and just all of Arlington County in general. Next slide. So I always also start sometimes I kind of frame and reference, because a lot of times we hear a lot about the words equity, but sometimes we confuse equity with equality. So I think that this is a really, really great image, and it says equality is leaving, you know, the door open for anyone who has the means to approach it. But equity is really about ensuring that there is a pathway to the door for those who need it. So I think that's always a good, very inspirational quote in terms of equality and equity, and really what we're looking for equity, but more so importantly for APS is around educational equity. So if we go to the next slide, we kind of had, how do we know when we reached it? Or actually, I'm going to go past this one. Let me speed up a little bit. This is kind of organizational chart. We can go past this one as well. Educational equity. How do we know when we've actually reached the mountaintop? Is that when we know when we have eliminated the predictability of student outcomes based upon their identities. And that really speaks to what educational equity is and how we have achieved this. When we're able to not look at a student by how they look, their ability, but we know that we can no longer predict those student outcomes and those variables. And we're not there yet, but we're trying to get a little bit closer each and every day. So next slide. And that's really, you know, so I also like this slide here. And these things wanted to show that this is really an initiative that is not just for APS, but this is a statewide initiative. So Virginia has an Office of Equity in terms of their school, Virginia's school board. And this is really a very great infographic in terms of how to operationalize educational equity. And what you kind of see here, and I'm trying to manipulate, manipulate Zoom here a little bit. But what you see here, really way to operationalize it. So what you'll see is equality. So equality is providing the same inputs, no matter what the variables are, is providing the same thing. And what you see at the bottom really is about the plants. And you know that if you look at the plants, is that there are certain plants that need more water, there's certain plants that need less water. They may survive, but are they thriving? So equity is looking at what each individual plant needs, what each individual person needs, and then changing those outcomes or those outputs to provide specifically what that targeted group or what that targeted population might need. So now they went from just surviving, but now they're thriving because they're getting exactly what they need at the exact moment that they need it. And that's really how we kind of operationalize systemic equity across the system. Next slide. In terms of the plan, and you know that my role is new this year to APS, but I'm the first that ever have a chief of diversity for APS. And of course, my role and position is really new across the landscape in many K-12 landscapes. But So my plan this year was really built around a 3-year plan. The first year is establishing our work. What does that look like? The second year is once we have established some of the core foundational points, then it's around implementing what it is that we established. And the next year is really around fortifying what we implement. Next slide. So here's some core things that this year, and I did a listening tour, and I'm still on a listening tour, and I will always listen. So what I believe in is that you have to listen, you have to learn, and you have to lead. So I'm always here to listen and always here to learn. But during that listening tour, I understood and I asked the question, so what is equity? And if I were to ask 10 different people, I was able to get 10 different answers. So I said, the good foundational starting point for us is to try to understand equity. And it's a process. We'll get there, and we're getting there, but we need to message really and understand what equity is and define equity. So on October 12th, we had a day of learning, and it was from the boardroom to the classroom and all of us in between, to where we had a PD to really start defining. And we first started with what is inequity, and then how do we define equity as a result with Dr. Paul Gorski. So developing that common language is very important as we move forward, but also talking about what are our core beliefs. You cannot talk about equity unless you understand exactly what your core beliefs are and your systems. And it starts with you personally and doing that self-reflection. And then we wanted to talk about how do we prepare for organizational change? Because you have to know how to meet the resistance and organizational change and understand that it's a process. It's not something that happens overnight. So we wanted to collect data. We wanted to find out and do some asset mapping. Also, who are those people that are ready right here and right now to kind of move the needle and do the work, and then create again those frameworks and understanding the organizational culture. I'm from Ohio, brand new to Virginia, so there's a different culture right here that I need to understand and be part of in terms of that landscape as well. And then also looking at our high yield strategies. So there's certain strategies we want to have in place as we're moving the needle and advancing, and making sure that we have an organizational commitment. And one of the things we did with that is we created our equity team. So we just launched equity teams this year for the first time within APS, that every school in this whole county has an equity team, and we're working on that and getting that up and running. We actually had our second meeting on this week in February, and we're going to have monthly meetings thereafter, and all of our schools are having meetings and meeting. And I can say that I am so pleased because there's been a lot that have come out of that work and those meetings, where I'm seeing the advocacy start to build. So I'm seeing the capacity, and people say, hey, there might be a situation with that that's just not quite fair. And they're bringing it to my attention, and they're bringing it to administrators' attention, and changes are starting to happen. So we're also identifying, what are those levers of change? And then also the equity policy that, that we adopted in August. Next slide. So I talked a little bit about this earlier, and this is a framework and an approach, and it's something that I was able to be a part of from a systems perspective in Ohio. And one of my roles there in Ohio was looking at what are the things going on nationally and also across the state that were best practices. So one thing I found is what was really working is looking at the STRIVE partnership that really looked at collective impact. And I met with a lot of you, a lot of groups, and that are well-intentioned in Arlington and have some really great ideas, some really great things going on. But how do we leverage that? How do we mobilize that? How do we make collective impact to really make change and drive institutional changes that we want to make? So we're in the beginning exploratory stages about what that looks like, but there's a lot of different partnerships going on right now, and want you to kind of see, if we take a cradle to a career approach, then we're really able to look at the whole child and look at the whole person. So it's a different kind of approach to addressing the problem, but it's going to take all of us. So our partnerships and strategic partnerships that we have out there with some of the corporations, with some of the foundations, health. I met with Destination 2027 today. I've met with the Y and a lot of these different organizations, as well as the county. How do we look at our collective impact? So next slide. In terms of the equity teams, this is just an example of the framework. So we have an equity team protocol that was developed that has our our kind of our values in terms of what the equity teams are. And what we ask is that these equity teams are manageable, but we want to make sure that they're diverse and that they actually look like the student population that we serve in the community at large. So it's not just that there will be teachers on the equity teams, but we're talking about there will be all scales of representation, that there will be families, that as well as students. And we're working on that. We're not quite there yet. We're still looking for some families on some teams, as well as some students to be on our equity teams. But it's something that we're going to use to definitely promote institutional change across the school system. Next slide. This again is just the infographic. We kind of built this around a toolkit in 5 stages of getting started. And we created this, so our equity team influencers who lead this work. The team members, team development, setting the focus and goals, and also the foundations of equity literacy. Next slide. This going back to our training, you can kind of see here, again, on October 12th, we had a full day of learning for all of us. That included a keynote by Dr. Gorski to really establish what is equity. And we're going to continue this work. And then also there's a cohort that are also attending his racial equity facilitator training. Some of those are the equity influencers, or who are the leads who are leading some of this work. And then we're going to come together after the cohort that ends this month and start working on putting together some of the framework, putting together some of the training to advance the mission across Arlington Public Schools. Next slide. I was asked if I could maybe show some data in terms of who is returning to school. And this is some current data in terms of the hybrid versus the virtual. So you can see here is there's about 44% of students that are choosing to remain in virtual, and then about 56% of students that are electing to come back hybrid. Next slide. And the next slide kind of has a demographic breakdown for you, so you can see for special ed population, our English learners, economically disadvantaged, and our African-American population of who is returning to go hybrid, and also those that are electing to go to remain virtual. And I can't monitor the chat, but I'll get to it. So part of the equity teamwork and the strategy is No Place for Hate. We rolled that out again in January. No Place for Hate is a framework. It was designed by the Anti-Defamation League, but we have tailored it for APS. So this is an APS framework in terms of advancing and combating bias, bullying, and hatred within schools, to make sure that we're building an inclusive environment across all of our buildings. So right now we've rolled this out in our elementary schools, and all elementaries are doing it, as well as our high schools. And it's really going to be a great program and a great initiative in terms of student ambassadorship. And this isn't about fixing kids, but this is about giving them the tools to be able to combat these things and to move from being bystanders to allies, but also for our staff who are saying, hey, we have something, we don't really know how to have these challenging conversations. Can you help us? So this provides us with the resource and some of the framework in order to have these conversations within our classroom. And we're providing them with monthly support from myself, and from my team, are supporting our buildings as we're implementing No Place for Hate. Next slide. This is just a quick glance. I won't go over it. This is really a quick glance at the equity policy. And what you can also see here is part of our family community engagement. You can see the face icon. So what we did is we broke this down kind of into some core values here. And you can see clearly where our family community engagement work fits into our equity policy. As you know, family community engagement, Isabel Mesmer, is kind of an office of one that does the work around FACE for the whole school system. And there was a PIP as well as a policy that actually is under the board, because the board identified that family community engagement was a core value for the board. So that policy is actually for the board policy, and that position is the board's position around family community engagement. Next slide. Educational practices, this is another, just breaking into the allocations of the equity policy. Again, FACE fits into inclusion as well as student support. And next slide. I did this several months ago, talking a little bit about the impact of COVID-19 with Northern Virginia funders. And what we do know is that there's been a digital divide that's been exposed. There's been academic and achievement gaps that have been exposed. And there's also been that mental health piece that we have to address that's also been exposed, and the lack of services. When I talked to our social workers, they said, hey, we're really having some concerns here with our adolescent population in terms of finding mental health and the social emotional supports for them. So there's some things that we're gonna have to think about and to address as we've been out of school for a while, that we may have some students that have anxiety, and how do we approach that as an equity issue. And you can kind of see how, you know, the proficiency and those kind of things, but also across the whole state and the landscape in terms of the variance between who even has a computer at home. So these are still kind of telling things that across the whole system and nationally that we have to address. Next slide. One of the things that in the deliverables this year was creating an equity profile. And equity profile, some of you may be more familiar with the word an equity scorecard, but it's really a systems approach and a strategy that really talks about all your data and your equity metrics. And what we want to do, and it's particular exclusive for this group, is I know you all are data driven, so I wanted to kind of show this to you a little bit, is that we're going to put the data back out there. We're going to make sure it's transparent. We're going to make sure that we're able to look at the data. The equity profile will not just be student performance data, but we're also looking at demographics for our workforce. That'll be part of this. That'll be forward facing, that we'll use as well as a tool. Also looking at our, you know, our survey data, and making sure that we have student voice also information as part of this equity profile as well. So we're going to use this in multiple ways. We're going to use it at the system level and at the school division. We're going to use it at the building level, as well as it'll be there for you all to be able to use and be able to see in terms of how are we moving? How are we moving the needle and advancing our equity and our equity metrics for APS? And it'll also help with our strategic planning as we look at retuning and planning our next strategic plan, because we can establish what the baseline is and then also know where we need to grow. So here you just kind of see it's just basic overview, just really some of those success indicators around advanced courses and basic skills. And then you can also see how we use that data to examine it and disaggregate it by different student groups to identify where those equity gaps are that we need to close. Next slide. And this is just basically, you all know this, is just looking at Maslow's hierarchy of needs and knowing that we have to address our students' basic needs first before we can even address some of their academic needs. So, you know, these are some of the things that were identified as still being current concerns around the rent assistance, food insecurity, and it even came about hygiene products and those types of things. So those are some of the barriers, and you can see the barriers in terms of mental health for our staff and students. So I'll open this up now and see if there might be any questions that I can answer.
And I'll leave this open in case anybody wants to go back to a particular slide. But I know we saw one question. Linda was asking, were you surprised by the number of kids that were hybrid versus virtual? So
well, I mean, I think this leads to a greater conversation in terms of the why. And we need to actually have questions. We need to answer and talk a little bit about the why. Who is returning? Why are they returning? What is it that they need to have in place for them to return? And we have to get that. And I think that I never like when we talk about equity, making assumptions in terms of I think we have to ask those that are in this situation and our staff, our families, and our students, what is their why? Why did some elect to return, and why are those not returning, so that we can address what those concerns are? So no, it wasn't surprising. It wasn't surprising in terms of the demographic groups. I think that sometimes we jump to conclusions and we say it's because of the scare around COVID-19 and the lack of healthcare, knowing that it's affected Black and Brown communities the most in terms of, with COVID, in terms of, in terms of deaths, in terms of, great sickness and illness. But are there also some other underlying reasons out there why we see, some differences within who's returning to hybrid? And I think we have to flesh that out.
Are there other questions? Anybody want to unmute themselves?
I have a question. This is Grace. I was just curious, and you may be not the person to ask this, but since you pulled these together, and I'm still new, so I should also be able to answer this question, but I'm just curious if any of these numbers, is Arlington limiting how many children can come back per classroom? So is there any way to, so Fairfax is limiting the number of students that can come back per classroom. And so if you don't get in the first 10, then you're waitlisted and you have to remain virtual. And so I was curious if Arlington is doing the same thing, and if they are, what those numbers would look like added in here.
Well, I know that, I don't know if Jeanette, I know she's here.
Yeah.
She might be, can you
Yeah.
tell us, Jeanette? Thanks.
Yes, you can phone a friend, Aaron. Yes.
Tag her in.
Yes. So we did, the only cap that we have for classes from grades 3 to 5, well, actually, yeah, 3 to 5 would have been based on the social distancing capacity. So our classrooms vary, but in the most case, on average, you can fit about 12 students in there. So that was the max, and that's really not that's not something that we impose. It's something that our capacity and social distancing requirements imposed on us. So what we did was, because families were able to make selections, and teachers and principals were able to hopefully accommodate, for the most part, those selections initially. And so in the pre-K to second grade, we have a model where there are some classes that will be fully virtual because that's what parents selected. So some teachers are assigned to a full virtual classroom, while other teachers are assigned to a full to a class. And in our pre-K to 2 model, knowing that that's a very vulnerable group, they're early learners, we are able to provide the full size of a class, around 20, 22, but not in the same room. We're splitting them in between 2 rooms. So each class is actually 2 classrooms. So you have the teacher who will be in one classroom at one time, and the other, and then an assistant in the other, and then they will switch. So that is how we've addressed maximizing in-person learning for our youngest, earliest learners. And then for our 3 to 12 model, we have, like I mentioned, limited capacity. So we have students who will be there in person up to 12, and then the remainder with the same teacher will be in virtual.
Thank you.
Anne Marie, I see you have your hand up.
Yeah. So I had a question, not a question, but more of a comment on the digital divide, because I've spoken to a couple of people. I serve on the School Health Advisory Board and the Science Advisory Committee. And while, yes, there's a digital divide for sure, there's not even places in Virginia that has Wi-Fi access because there's no towers built, but also the digital divide is getting wider in many different ways. And one is the time spent off screen, like having enrichment classes and availability to things off screen is getting wider, and just having a guide on the side at home, monitoring what's going on with the quality of what's coming across the screen sometimes as well. So I just want to emphasize that, or even like proper use of a digital device where the kids are taking the breaks that are needed and things like that. So just wanted to emphasize that the divide, in not just my opinion, is seemingly getting like wider.
Any response to that, or is that just, yes, we understand that's a need?
So, I mean, I was in a call earlier, so we know that the digital divide, I think Arlington is a different, unique situation. I know that we're looking at a sustainability plan, and how do we sustain it? So we know that it's not just solely about having a device, but you also have the connectivity, and, our information services department is working nonstop. And so as a superintendent, that we'll be rolling out to create the sustainability plan. Of course, we have MiFis and those types of things. We, of course, have the partnership that we developed with the county in terms of Comcast. But we're going to have to sustain that, and that's going to come at a cost. So that also helps create that digital divide that, and I'm hoping that, we start a campaign that we're looking at the state, and we're also considering, that this is an impact not just here locally, but this is a national impact. And how do we make the internet and those kinds of things a public utility? It was also said to me today that, hey, there are some families that were having a hard time paying the $10 a month for Comcast. Also, there are also some families that had to take their students, they had the Comcast, but they also had to take their students to work with them. So for those, we also provided MiFi devices for students and families that were in that situation, so that if they were not at home with Comcast, that they would still be able to take part in their learning. So I think we're doing what we can here at APS, but I agree that, this is something that we're going to have to attack and have to address.
So I'm
Yeah,
gonna
absolutely.
I'm going to look at some of the questions from a little bit back. So I think this was in relationship to the virtual versus hybrid. Does APS have a plan for fleshing out some of the whys, and what's the timeline on that?
Yeah, I can follow up and see, whether or not we are, I know that there's a lot of survey fatigue right now for obvious reasons. So we can definitely have to follow up on that in terms of figuring out what is those why. But those are some of the questions I have.
Yep.
Who are returning, and how do we get more students to return to the hybrid instruction?
And I'm happy to chime in on that from the board's perspective.
Oh, sure.
Our perspective here is to educate students in whatever format their families have chosen for them, and to make sure that we're meeting their needs in whatever format their families have chosen for them. As we're continuing to go forward and we're trying to make sure that we are delivering that education equitably, we are keeping very mindful of things like the digital divide and of device access, as well as access to resource for students with disabilities. And we are constantly paying attention to that. And that is very high on the forefront for all of the board members. And it is something we talk about on a regular basis. I do ask, as we're thinking about these situations, if you're finding unique edge cases or particular situations that do require additional attention, and you want to raise them and elevate them to the perspective of the board, feel free to use me as a resource. I'm happy to read through emails and continue to see the higher level policy decisions, so we can support the entire team. I think it's really important to remember that we in APS, in the county writ large, we all work as a team, and we are taking the same problem and we are attacking it in different aspects, and all the work that Erin does and that Jeannette does, everyone else on the team does, it all fits together and creates a coherent experience. And we all need to be supporting each other from our different vantage points. So the more you can elevate to any one of us, the more we can collaborate, the better.
Thank you. Can you say more about the work that the equity teams will do? Is there an example of how the work is operationalized?
Sure. So it's very important to move at the same pace. And in Arlington, there have been many schools that have had a team. It may not be the defined team such as the equity team, but there are many teams within APS that are also already starting to do that work. We also had a deep equity cohort. I think we're on year 2 of that. A deep equity cohort was around several buildings. So right now, what we're trying to do is we're trying to align all those different functions of deep equity and those things in individual buildings, so we can make sure that we're having that same common framework. So what we're going to do is that we're going to have common data that we look at every month. So the division from a top-down approach is going to drive some of that work within our building. So one month we want to look at discipline data. So we'll say, okay, this month we're going to look at discipline data. The next one might be student performance data. The next month might be school climate data and survey data, like from the survey that you all helped us sponsor. It might be that data and your voice and looking at our student voice. So we're going to really take a systems approach to this, so that it's not every building doing something different, but we have something in common. Then after that, another thing we're looking at is also being able to establish where we are as an organization, so that we can align the work around a rubric. And that's already been the implementation stage and already been designed. We already have it. We need to roll it out to our buildings. So hopefully by the end of this year, we will have at least one round to where we'll be able to look at how we are performing currently, and that we're able to measure that as we grow and as we grow as a school division around equity. And those are really around 10 dimensions of educational equity and leadership. So we'll be able to calibrate that. And I'm hoping to be able to have that before the board and before all of us, so you can kind of see where we are in terms of establishing a baseline.
Sort of related to that, how are you going to be selecting students for the equity teams? Is it applications or referrals?
Sure. So this year we did, staff and DI did create a survey, an application process that it was optional this year, that they could be used. And we're trying to make sure that it wasn't too much of a heavy lift for our buildings, as during that time it was around January or so. But we wanted to make sure that it's a fair and neutral process. So some of our buildings right now have students and students on them, and some of them are still looking to find students that want to be on the equity teams, especially some of our elementary schools. So it's not going to be, again, we want to make sure that teams are manageable. It's not going to be a lot of families or a lot of students, but we want to make sure it's manageable. What I would say is that in terms of the elementary students, participate in No Place for Hate. This is really designed for you, and they're going to do No Place for Hate committees. And that's where we're going to get our student voice, from that No Place for Hate committee with our elementary. At the secondary level, the same way. There will be maybe some subcommittee work that might be for students as well to get involved in. And every building has an equity coordinator. At the secondary level, I'll reach out to them, and I can also provide some information in the chat here if you're interested, for the 2 DEI specialists that help support our elementary schools. And we can tell you who that contact person is for the building.
Okay, John, you have your hand raised.
Yeah, I was going to say that the distinction between equality and equity has been really important, and I'm thrilled this has come to the fore. When I look at the definitions in an earlier chart, and even the watering of plants, I think there's a piece that's still missing in equity, and that's the incentive. The plants can sit there, and if you give them sun and water, they'll do the right thing. But if you make equity opportunity and a pathway for kids, they may still not have the incentive to do something. The number of kids I hear that say, what's the use, when they aren't doing well, really disturbs me. So the more you can think of incentive for kids to want to take advantage of the equity opportunities and all the support systems, I think that would be a really desirable. Just put the word in somewhere so we can start thinking about it.
So I mean, I want to dig in deeper to that. I know we probably don't have time, but I'd love to dig in deeper, because what we're looking at is removing barriers for all of our students. What you're saying is about opportunity and access, opportunity, and inclusivity. But what I'm hearing you're saying is that it sounds like you're saying that the students need incentives to help me out here.
Aaron, I'm sorry for those that have heard me say it before. I have plenty of access to exercise, and I know how valuable it is, and I don't always do it. Somewhere the incentive is missing, even though I have opportunity all the way. And I think with kids, it's the same way. Sometimes they won't take advantage of something handed to them. I mean, the sun's there, the water's there. They sit there looking at it and say, I'm not ready for it. So if you can think about it some more, I'd love to see it. I'm available anytime I ask questions, that's all.
There were a lot of comments about how nice this slide is about the equality and equity, and really demonstrating it in a different way than the kids at the baseball game. So thank you.
And Kim, feel free if you want to, create this PDF and send it out to.
Yep. Will do. The choice of hybrid versus virtual. Do the messages from the school to their communities differ from school to school? I wonder about school communities and their choices. Do the choices of whether the teachers went to or can return play a role in the messages going out to the school communities? Does that make sense? Did I read it right?
It says want to or can return.
Yeah.
So for our third through 12th grade, and I'm sorry, Aaron, I'll take that question. I think it's
Yep.
really return to school. For our 3rd through 5th, I'm sorry, 3rd through 12, I'm sorry, I'm so used to compartmentalizing elementary, middle. So from 3rd through 12th, the decision of the teacher should not have impacted the parent selection, because the teacher being virtual or being in person, the teacher would remain that student's teacher. Now, if a parent had a preference that teacher be there fully, then that may have impacted. But parents made selections prior to knowing what our teacher accommodations or teachers assignments. So there has been some opportunity at this point now for some changes in assignments now that students are returning next week, based on a teacher either being in the class or being virtual. But that is very limited based on, and it goes from school to school. So that communication is unique to the school building and is unique to that teacher. For example, a 2nd grade teacher, if a student in another 2nd grade class elected to be in person, but so the principal would call that family, or someone in the school would call that family and say, you selected to be in person with, Dr. Allen as your teacher, but Dr. Allen is going to be the virtual 2nd grade teacher. If you want to stay with Dr. Allen, I can move you to virtual. If you want to stay hybrid and come in person 2 days a week, then your teacher will change to Mr. Gregory. So those are unique and very school specific, based on, so the overall course selection, selection of hybrid and hybrid and virtual was done prior to the teacher. And now we're having some nuanced because they're, as accommodations and as assignments are coming in, that's where those conversations are taking place.
Are there any other questions for either Jeannette or Aaron? And Jeannette, can you just say a little bit about what you shared with everybody that I sent out in the note today? I sent them the link that you shared with me. Are you on mute? You're on mute. That's okay.
Sorry, I shared with Kim the site, our return to school site, which is pretty comprehensive, has a frequently asked questions and kind of outlines our health and safety metrics, COVID dashboard, the different instructional models. So Kim had asked me like, what can the partnership do to help? And I kind of put it back on Kim, like, oh, well, what would they like to help? What would you all want to help with? Because I don't want to impose and say what you all should be doing. So I'm here to listen and to see what areas of interest the partnership is in advocating or kind of helping with.
Does anybody have any thoughts or things they'd like to share about that? I think we want to be able to help share the message about the information, and so that's why we've got quite a few questions about hybrid versus virtual versus all of the other different choices that there are to make sure that we're spreading the facts and the information correctly.
So speaking on the topic of messaging, I can let you know that this is new with Dr. Duran, but Dr. Duran sends a weekly message to both staff and families. So they receive the overall message. And both messages are slightly similar, but that is his effort to making sure that families are aware of what's going on. Additionally, every 2 weeks at the school board meetings, he's his It's not only his superintendent's updates, but a very comprehensive monitoring report, and all of those are available on board docs. And then obviously we also communicate through our school and community relations, other things that are going on within the system. But the website is a tremendous resource. We also have, for those of you who are concerned with staff communication, we also have an intranet, and that's where we're putting a staff specific and more detail information, but it's also available. A lot of that information also lives in our public website. But wanted to make sure that folks know that that's been our communication vehicles. We've also been, there's a lot of information and a lot of content, and these emails are pretty comprehensive, and so are the monitoring reports. So our school and community relations department has been working on doing videos to kind of enhance. And so, I know for myself, I'm, you're pretty saturated with the level of information that you have. So it's helpful to hear it in multiple forms. So not only visually but also auditorial. So I want to see it, I want to read it, and then listen. So we have some videos as well that are helping to support the different things. So we have a health screening video coming out for families, so they understand that process on how to health screen prior to coming to school. We have that for staff. We are already engaging in that. And then we had a safety video prior for staff to return. So we're trying to keep up with all of the communication necessary, but also knowing that, everybody's kind of inundated with a lot of information at this time.
Thank you. Are there any other questions? Did I miss any in the chat that anybody wants to jump in with? Laura, we haven't heard from you. Is there anything that you would like to share with the partnership regarding back to school and how kids are doing?
Well, sure. First of all, I want to start by saying that APS have partnered with Cigna. Many of you may already know that, but I just want to emphasize the fact that we partnered with them at the beginning of February, and this is to make a school support line available to provide our students with mental health and crisis support, and this is 24/7, 365 days a year. The support line is available now to all high school students and programs. And I know at the beginning, people were questioning if all high schools were going to be served. Yes, they are going to be served. The line is available in English and Spanish. And this is available for students over the age of 14. This is a pilot program. And one of the agreements is that the student needs to be over the age of 14 in order to be able to serve them. Parents and school staff can take advantage of the services as well. And this is 100% confidential. And that has become a very important issue for us, because many times we hear not only from the parents, but for the students, that they want to be reassured that when they talk to somebody, that will remain confidential. So calling Cigna, nobody in the school will know that phone call that was made. So that's going to be very, very important for us. And we will know more. We'll have an update from Cigna next week after they have been giving us a full month service. So we don't have any data right now as to what services they have provided or who has called. We're hoping to learn more next week as to who called and what services they have provided. In terms of next week, we know that our pre-K to second students will be back. I want to reassure everybody that we'll continue to provide services, student services, the same both in hybrid and virtual. We're going to have members of the student services staff in person at school every day that the school is open. We will continue to provide lessons as we have been doing, but we are going to focus on managing feelings, calming down, how to remain safe, how to communicate personal concerns about space, personal space, coping with change, transition, making friends, and continue check-ins. One of the things that are going to be different is we're going to begin lunch bunches for the young kids, but this would be virtually so that they can have a sense of togetherness and they feel like they're not, outside. The counselors are also going to be on call, if you will. And that means that if students are struggling in class and feeling, antsy, the counselors will go to the classroom and meet them outside and talk to them so that they can be reassured and then so that they can rejoin the class and do better. The also counselors will be creating small groups to address students who are having a hard time adjusting to in-person learning. They also will have a list of in-person activities with building community and what can they do socially responsibly so that, that you can meet, but, we need to keep our safe, distance when we do that. And student services teams will follow up with the families because we know that many people are struggling and we want to help out. Also, we are going to be checking on attendance because many of the students that have signed up for hybrid may decide that they don't want to come back in person, 2 days a week. And so we want to reach out to them and find out, if there's anything that we can do and help, with the family in any event that we are. Next week, since I mentioned it's pre-K to 2, we are really going to help the students. We know there's going to be new teachers and new classmates. So we're really going to focus on how to be friendly with one another while you're keeping your social distance, and lessons on resiliency and community building, and also on emotional regulation, because we feel like that first week might be frustrating for kids that are coming back. So these are some of the things that come to mind.
That's a lot. That's a lot. Thank you so much. Are there any questions for Laura? Thank you to our school partners for joining us. I did meet with Brian Stockton yesterday. He was sorry he wasn't going to be able to join us tonight, but he looks forward to coming to a meeting at a different time. And he is committed and wants to be a partner of the partnership and the work that we're doing. He just wasn't able to join us this evening. Any final thoughts before I move us on? Okay, I think that was good wait time. The next on the agenda is, I thought I would give Grace a little bit of time to share a little bit about herself more than just her name, and a little bit about what the data plan is moving forward. Grace, I will turn it over to you.
Hi. My introduction earlier wasn't enough. You needed more. Well, hello. I'm sorry that I was off my cue earlier. I'm Grace Wagner. I am new to this role, new to Arlington. I am a Fairfax resident, but I've been in Northern Virginia for, oh my gosh, almost 11 years now. So pretty familiar with the area, the dynamics. I'm coming into this role from the private sector. I've been in education consulting for 8 or 9 years now. And in those roles, I have done a lot with data from the beginning of collecting it to cleaning it to analyzing it to reporting it out and then disseminating it. So I just love a really good spreadsheet. I'm really excited to be in this role. I'm excited to be working back in government. This role is super interesting to be part of both. I am an APS employee, and so to be part of both sides of, to have like this straddle position of knowing what's going on with the communities in this partnership, and also what's in happening with APS. So I'm excited for that. As I said earlier, I'll be reaching out to people just to do introductions. I've only been on, Friday will be 3 weeks, so still pretty new. Still getting my feet wet. Kim has invited me to a lot of meetings, which is great. I've been listening into a lot of different things, and it's been wonderful to hear what's happening. And then I have to sit down and kind of weed through all of that and take everything that I'm hearing in this meeting and everything I'm hearing in this meeting and trying to figure out, do these connect, or am I hearing this double? Like, so, and then how I can support these conversations. So that's kind of it. Kim, is there something else you wanted me to say?
No, that's good.
Okay.
I know that there's a lot of folks here who are interested in data. So maybe if you jump up and down and wave your hands, if you want Grace to reach out to you, then I see John is waving his hands, and Lynn and Devanshi's giving a thumbs up. So, and Alicia and Anne Marie. So there's a few folks.
Yeah.
And there used to be an opportunity for there to be a data committee meeting. Not that we need to have another committee meeting right now, but maybe there's an opportunity for you to pull some people together just to talk about what is the data for the partnership and what should we be working on.
Building some more spreadsheets. Yeah, I love it. So I will actually, I got some of those names down, but I will put both emails. I have an APS email and also a government email. I will put both of those in the chat. And so if you don't hear from me in a couple days, but feel free to reach out. I'm here. And so absolutely don't wait for me to come to you if you want to come to me first. So I'll put both of those in the chat, and feel free to reach out.
Great. And Aaron also put his information in the chat. So, and I'll include those also in the notes. All right, I would like to call on Lisa Kaplowitz now, just to talk about the latest on the COVID vaccines in the county, and are we reaching everyone, and how can we help?
Okay, well, we now have 2 vaccination sites, one at Sequoia and one at Walter Reed Community Center. And we're vaccinating all folks at both centers. We have 2 vaccines. We have Pfizer and Moderna, and we're using them at both centers. For people who are interested, the Johnson & Johnson vaccine is likely to be approved at the end of this week. And the Advisory Committee on Immunization Practices may put out their recommendations on Sunday. So we may even have Johnson & Johnson vaccine, though I have no idea how that's going to be distributed and how decisions are going to be made on that. We still have a relative shortage of vaccine. There's, great demand, and we don't have enough vaccine, but both companies, well, all 3 companies are really going to be gearing up their production. So it sounds like by April, end of May, we'll have a lot more vaccine. Now we've been vaccinating people in 1A, which are healthcare providers and long-term care and assisted living facilities. And the nursing homes and assisted living have almost all been covered already by CVS or Walgreens. Yeah, it's Walgreens. So they'll be finishing up their vaccination in those facilities very soon. We'll have to deal with new staff and new residents, but the ones who've been there have had the ability to get the vaccine. I don't know what the percentages of staff in the long-term care facilities who've chosen the vaccine. There's been some concern that many staff are not choosing to get it, but I think we're doing better there as well. So we're into 1B, and 1B is pretty big. It includes everybody over 75, but we're now into 65 plus and moving toward people under 65 who have medical conditions. We've also vaccinated staff of APS, and I think we've been able to cover most of them. I know we're still vaccinating some, but anybody who with the schools who wants to be vaccinated definitely should have access to vaccine. And I know many have had their second dose. I know that's a big deal for many teachers who want to be sure they have some maximum protection by the time they go into the classroom. And I think that'll be the case, certainly by the end of March, but even now. And so 1B will also include a lot of other folks. It'll include some public transportation. It'll include food workers in grocery stores and farmers markets. And there's a lot of breakdown. I think it also includes Uber drivers and Lyft, but I have to look into that because I know I'll be talking to some groups. In terms of outreach, I know we've had outreach to the jail and to the homeless shelters. I've been concerned about outreach to affordable housing. We're not quite there yet, but very soon Arlington Free Clinic is going to be able to offer vaccine. And I've been talking to Nancy White. They don't have their system set up quite yet. And obviously they serve, underserved Black, Latinx populations. So that really should help in terms of equity with the vaccine. Quite frankly, we've been reaching mainly those folks who are savvy, get online, know how they have access to appointments. The information is on the website in terms of registering, pre-registering. So we're moving along. I'm still a little frustrated in terms of reaching out to hard to reach populations. I know I'll be talking to two groups of refugees next week. I've offered to talk to any number of groups to kind of increase their comfort level with the vaccines. I'm hoping that the message is coming across that enough people have been vaccinated to kind of overcome some of the fears of some people, that this is new, but we have now experience with millions and millions of people. We've had a couple of folks with severe allergic reactions in our clinic. It's been handled beautifully. We've given epinephrine. EMS is actually in our clinics, which gives us a really good comfort level. So, it's very unusual, but we see that. And the second dose of vaccine tends to give people more of a reaction than the first dose. You tend to feel wiped out for 24 hours. But things are moving along. We still have a lot of work to do to reach everybody. One other piece is that vaccine is starting to be sent to CVSs. Not all of them, but that's going to be expanded too.
Anita's on the call, and it looks like Anita had her hand up. Do you want to jump in, Anita?
Sure. Thank you, Anita.
Just to expand a little on what you're talking about, Lisa. Number one is the Arlington Free Clinic is just about to sign a contract with the county this week. So that should be up and running very soon, where they'll be able to offer vaccine to low-income residents and a large portion of their clients are uninsured, so that'll be a primary target. I wanted to mention that there's something called the Complete Vaccine Committee, which is doing outreach to our neighborhoods which are primarily Black or Latinx, where we are taking sort of our registration system out to the community in order to get people to sign into the Virginia pre-registration site, even if it's not their time yet. We started this week. We reached 120 people this week at
Great.
AFAC and a couple of APA and AHC properties. We also have a methodology where if people don't have email, because that is the primary, way in which they're being notified, when we do get the lists of 75 plus or 65 plus year olds from the nonprofits or the affordable housing developers, we've been calling them to directly schedule their clinic appointments, which is important.
Great.
And I did want to mention I do have the specific CVSs and Safeways where the vaccine is available. Safeways on Harrison, Lee Highway, and Wilson Boulevard are getting approximately 70 doses a week. The Giant at 2901 Glebe is getting 195 doses a week. And the CVS on Columbia Pike, that's near Arlington Mill, is getting 100 doses a week. But they still have to follow the Virginia Department of Health guidelines with these categories that Lisa was referring to, 75 plus, then 65 plus, and then younger with medical conditions. So
and eventually the doses going to the pharmacies will increase dramatically. And there will be more pharmacies in that whole program as well. Both the feds and the state are really pushing hard to get it through the pharmacies.
If anybody in the partnership is interested in participating in the Complete Vaccine Committee, they can send their name to Kim or to me, and I'll happy to connect you to, that's a sort of an outgrowth of our Complete Census Committee. And there's a lot of opportunities to volunteer to pre-register people in the community.
And I'll share that information in the notes, but I think I have shared that in the past. There was a link, and I think I did share that last month, but happy to share it again because earlier today we heard about it from Destination 2027 group. And there's also a data dashboard, and I was trying to find that link, but there's a dashboard that has a lot of information about where the vaccines have been administered or to who. So I'll share that link as well.
Well, thank you, Anita, because you have more information about some of that outreach, and I'm very excited that that the not-for-profits are now engaged in really registering people and helping, especially for those who don't have access to internet or aren't quite as computer savvy. That's great.
Are there any questions for Lisa about the vaccine? I'm looking around the room to see. I think it's somebody on their iPhone said, great to hear. There's a lot of progress. And if anybody, last week, there was a committee of 100 did a program. And so I can see if I can find the link. Judy and a few of us were on watching it to see what they were going to be talking about. And they've got a very nice, clear chart of when different people can be vaccinated. So I'll try to share all of that as well.
I think what's really exciting is that in the next 2 months, we're going to see a lot more vaccine. It will just be much more widely available, and we'll have 3 of them. And I'm really now very optimistic about, the next 2 or 3 months and people really having access to it soon.
Okay. Good.
It's Linda. I have a question. Lisa, the 16 to 64 age group that would be in the next round, are they thinking about doing literally 16 to 64 or like 40 to 64 or whatever? Because if you think the number of 65 plus, I can't imagine 16 to 64.
Yeah, I mean, the next category is 16 to 64 with other medical conditions. And we're not requiring people to prove that they have other medical conditions.
Right.
Yeah, it's going to be a big jump, which is why I'm adding that the companies really are saying that the amount of vaccine will increase dramatically in the not too distant future. Also, both Pfizer and Moderna are have enrolled kids at least between 12 and 18. And, you know, I think there's still hope that the vaccine would be available for them sometime this summer, which would be really exciting if that could be before the next school year, both for, you know, school students, but also college students.
Any other questions or comments about vaccines and how we're getting out? All right, then I'm going to turn it over to Anita.
Okay. Well, I guess we're winding down in this meeting. And for those of you who don't know me, I'm the director of the Department of Human Services, which houses the Partnership for Children, Youth, and Families, even though it is a collaboration between schools and humans and the county. And one thing I wanted to say first before anything is that I am so utterly grateful to Kim, who has been just a pillar of this partnership for, I don't know, 10 years now?
It's been 10 years.
10 years. I was thinking it must be 10 years. And she has just been a mainstay, enthusiastic, a bridge between our department and the community, a cheerleader, a positive influence, a bright light, you know, a weaver of community ties. The role that she has played is really tremendous, and I know all of you will miss her. Now, I selfishly have the pleasure of being able to still work with her because she's moving to a key role in our department, which is the head of the community outreach program, which you may know is in charge of 6 different community center locations where we have outreach workers basically co-located in either community centers or affordable housing complexes, working with people who traditionally have challenges accessing our services. So what a better place than that, and what a better role than for Kim to be able to take that on, and I'm very grateful for that. So in light of that, we're entering into a transition phase. And the great thing is that the partnership in our organizational hierarchy is embedded in the Child and Family Services Division. And so we are fortunate to have the leadership of Tabitha Kelly and Jamie Premdas and Linier, Linier himself will be the interim person in charge of the partnership and be the liaison. He is the prevention director for the department, and he reports to Jamie Premdas, who reports to Tabitha. So you're going to be in good hands in the meantime while we embark on a search for a new leader. I do think, as all transitions in our current environment warrant times to think and rethink and examine and reflect on who we want to be, where we want to go, how we want to be as a partnership. And in light of that, I was going to suggest that maybe we do a survey of the partnership members to make sure that we get the best and most recent information about what kinds of priorities we currently have, and also take advantage of this unique partnership, this unique role where we have county and APS together at the table in this important time of moving racial equity forward and moving the ball forward on bringing positive outcomes to those children and families who are most in need of our community. With the help of the folks who we know are available, like Arron Gregory, like Samia Bird, and really try and put ourselves out there as a force for equity in this community, which I know you all are very excited about. So we will be having some more conversations. We're going to have a survey, and you can direct any immediate questions to Lynn, Jamie, or Tabitha in the meantime, and we'll be working closely together to find the right next person who can be the next partnership staff coordinator. And I'm very hopeful that you all will be patient and participate in this process of moving forward. So that's what I wanted to let you know. I'm grateful to all of you community members and APS members and other county department members for your dedication to this partnership.
I thank you all so much. And thank you, Anita and Tabitha and Jamie and Lynn. I'm very excited for the next step for the partnership. And I will, of course, be still here to support and celebrate and do whatever I can in my new role. Are there any other questions or comments or thoughts about that? Trying to be good about.
Well, we're going to have you come back and report on your community outreach.
I know. I plan on busting into an agenda so that I can share and make sure that everybody is ready for that. So we've got a few upcoming meetings that I'll still be helping out with. And in the notes that I sent to you all, there's also the budget meetings. So this is the time of year when we would normally be sort of gearing up to advocacy. And so we don't want to miss that just because of transition. So the budget for APS is being rolled out tomorrow night. And so you should all check into that. I don't know, Christina, do you want to say anything about that?
You've really covered it. It's going to be coming tomorrow, and we're going to see the superintendent's proposed budget. It is going to be a tough year, and I think we all need to brace for continued uncertainty. We are optimistic that we will be getting some additional support from the federal government and from the state. But in the interim, we need to see where we're going to land on the way to get there. So more to come. Stay tuned. I hope you'll all be tuning in tomorrow to see the initial presentation.
And on the county side of things, I think there's already been something uploaded. And what they have on the county website is that the county board gathers feedback from March till April, and they host a series of work sessions and things like that. I don't have the exact dates. I couldn't find them on the website, but those are some things that we need to be looking out for. So I know that the school board has open hours, office hours that are virtual. So do the county board. And so just wanting to make sure that you all are keeping those in mind. And then I also shared the Engage pages for both the county and the schools, because that's really where we can get the most up-to-date information on various projects that the schools and the county are working on. And that we should probably really talk about at planning and development to get an advocacy action plan going. Are there any comments, thoughts? Yeah.
I can tell you briefly that, the county manager did submit his budget to the county board. There's no tax rate increase. And the reductions to the Department of Human Services are much lower than we originally anticipated. Housing grants and permanent supportive housing are fully funded for FY22. And we are also receiving additional funding for a emergency crisis response that's coming out of, for mental health, that's coming out of the recommendations of the police practices group.
And that's a group we want to hear from a little bit later. I know we were thinking about that for the March or April agenda to be able to hear from them what's going on. Well, I underestimated the meeting this time. Usually we run out of time and we don't have any time for announcements or anything. Rachel, do you want to share a little bit about what you're going to be doing? What is your transition plan between now and when you are retiring in August?
In April.
April.
Yes.
You said August earlier, and I thought, wow, that's a long time.
No, I meant April.
Okay.
But right now we're in the process of I always call it succession planning. So I'm working with other people on staff on that to see who's going to be taking up different things, what kind of projects I've been working on. So it's mostly doing that. But we have a lot of just the day-to-day operations that are still going on too, getting everything ready for people to pick up. But it's mostly succession planning. And so that's pretty exciting.
After that, you're going on a long vacation?
Actually, I'm moving home. I'm moving to Maine. So probably by early summer, I'll be moved back to Maine. And where my mother, who is 90, lives, who got her second shot yesterday. And today, after her 2-mile walk, said, I felt a little tired. I thought I should lay down.
Good for her. Good
Yeah.
for her.
So yeah, that would be nice.
So I'm looking around and we've got some agency folks. So I'm wondering, does anybody have any announcements that they want to share? So Kim from DPR. Lynn, Jamie, Tabitha. Rick. Lynn, do you want to share anything about the webinar series?
Sure. So we're still putting out 2 to 3 webinar series on Mondays from the Monday group, and we're working hard right now for the May event. I think I may have mentioned in this group, but May is Mental Health Awareness Month, and we are doing a symposium on mental health awareness, and we're calling it, the working title is Building Healing Communities, Conversations on Mental Health, Equity and Resiliency. So we're beginning to pull it together. We'll have a flyer soon, and we're still meeting with our community partners to really make it a community-wide event. So it will be a 3.5 hours virtual webinar format that has a plenary speaker, panelists, and then breakout groups. So we're looking forward to that event and working really hard on that.
And I see that Trini has her hand up.
Hi. Okay, so I just want to talk really quickly about one of the groups in Teen Network Board is running a drive for foster homes, and I'm going to drop the Sign Up Genius link in the chat.
Thanks.
And they're still looking for stuff like hot cocoa and masks and gloves and stuff to donate. And yeah, donations would be at 2 drop-off points, which I think are the houses. And yeah, it would be really cool if you could donate stuff so we can support the foster homes in Arlington.
Where were the drop-off sites?
It's actually not in the Sign Up Genius, which I just saw, but I can also send them.
That's okay. That was a question from earlier. I think Judy was interested in donating some things and was wondering, Siobhan, do you have something?
Yeah, we can just list it as DHS, and I can corral stuff in the office because that's the way it's going to happen anyway. So might as well.
Judy, I'm going to be in the office on Friday. If you want to coordinate with me sometime too, or if anybody on the call wants to coordinate a time with me on Friday, I will be in the office so I can accept any donations if that's not too late, Trini. Okay. So if
No,
anybody,
I'll do that, Kim.
okay,
I'll get in touch with you.
okay,
Thanks.
sounds
Thanks.
good. Kim, did you unmute yourself because you've got something you want to say?
Yes, I actually have a question, so thanks for calling on me. The wish list, is there like, I didn't even look at it yet. Is there an Amazon link or somewhere where like we could just go in and select and have things delivered somewhere?
There isn't an actual list that's been established, but if you want
Okay.
to use Amazon and just have it delivered to me at the office, that'll be fine.
Okay.
Great
Okay.
idea. That's a great idea.
So I don't know, my connection might be a little slow, so I apologize for that. There's some big gaming going on downstairs, so. But just a couple of things really fast. If you do take a peek at the budget, and of course, all of this is proposed, I'm super excited, but we are proposing to offer full day preschool at the new Lubber Run Community Center with an extended 3 hours. So that will take the kids all the way up to, I think, 6 o'clock.
That's great.
So that's really exciting. We've been working hard to kind of expand our early childhood program. So, and just another couple of notes. I know everyone's always been wondering, Lubber Run is scheduled to open in the summer of 2021. We still don't know what amenities are going to be available because of COVID, but cross your fingers, everyone. We're getting closer. And then just a shameless plug for one of my units, Youth and Family. They are doing a spring break bag. So you can go and pay $20 and you can get a bag full of activities, and they're going to have videos along with it. And it will be a virtual program that you can follow along for spring break. So that's kind of neat and new for us. And you know, we're definitely putting our creative hat on even almost a year later.
Send me the information and the links so I can include it in the notes. That'd be great.
Okay, great. Thank you.
Tabitha, did you have something you wanted to add? I just saw your face all of a sudden and I thought, well, maybe you were ready to say something exciting.
You know, we always have something going on in Child and Family, but I don't have any like super pressing updates right now. Just remember, everyone, that CR2 is still available and under-resourced for mental health crises. So please, please, please utilize the service. And the service does in-person contact for families who need it, and will an expanded age range to 21. So that could be very, very helpful.
Wonderful. Okay. Any final thoughts? And then for anybody who wants to stick around, I pulled together some old photos that I thought I would share. Anybody? You're all just dying to see these pictures. So, you know, it's interesting. When I started 10 years ago, it was, you know, you had a digital camera and you walked around and you took pictures. And so I have a lot of pictures from then. It was a little bit harder to get the pictures from my iPhone onto my work computer. So there aren't as many recent ones, but I have a lot of fun pictures. And so anyway, I look forward to sharing them with you if I can. Let me figure out how to get there. It's not this one. There. Nope. Oh, darn it. Where'd it go? Here. Okay. And you guys, I'm going to play a song, but really, if you know from where this is, or if you want to yell out something about whatever the picture is that you see, you should go for it. So let's see. This was from one of our retreats, and we had a beach theme for that retreat. And why isn't it showing like I can slideshow? There we go. Okay, from the beginning. So that was the retreat. This was from the December 10th event that everybody always talks about. That was recent. Here's my song. You guys need to unmute so that I can hear if you're even listening.
Cameron, I wanted to be.
Yeah, that was one of the events with the teens. This was from this last summer. This is
I really wanted to get a cake from Safeway for this occasion.
Arlington All In. That's our awesome staff. We were making food for the homeless. One of the assets committees. This was above the influence. What year was that, Siobhan? This is one of our retreats.
That was 2013.
County Fair. I have a lot of county fair pictures. They're so much fun. Barbara, are you still on the phone? And that was Levita, one of our chairs. And I don't remember that team's name, but that was one of our team members. This was an assets conference. There we go, Devanshi and Siobhan. This was one of the county fairs, or maybe just one of the events we used to do at night. It's Teen Network Board, end of year celebration. This was on May 26th, one of the first report card meetings. Teen Kids, we participated in that. This was one of our retreats that we had where we did our colors.
Colors.
Yep, Dotocracy. This was one of the first county fairs that I participated. I don't even think I was the coordinator yet. I think I was just volunteering. This was peanut butter and jelly night that the teens were making. Kateri's in there. I don't think Kateri's on the call. There's Tito and Barbara. This was Mary Ann's retirement party. This is just one of our meetings. One of our summer picnics. Just a meeting. I can't remember which meeting. You can see that's an older one because Pat Romano was in that picture. This one was from this past year when we decided we were meeting at various libraries, and we got to go to 2 libraries before we had to stop meeting. Trisha and Mary Ann. We helped with the pinwheels for prevention for a lot of years. That was fun. Meg Tasillo, Mary Ann, and Pat Romano. They all retired in the same year. I don't know how we let that happen. This was the movie Bully. This was one of our community conversations over at Fairlington. This is us doing the pinwheels. This was the Raise the Roof event that we did with the teens, and we helped paint the Borromeo house. This was a holiday party. This was Let's Talk About Race, one of the small groups. There we go. Kateri again, and Anna and Mary Ann, and Alicia is one of our volunteers. This was one of our retreats that we had somebody facilitating with us. This was a Ready event. There's us at our picnic for the summer. I love that picture of us, John. Care for a Change. That was one of our initiatives a few years ago. Teen Network Board. Look at Tyler looking all. There's more teen. That was when they were celebrating Judy and Mary Ann for starting the Teen Network Board. That's the county fair. We had some fun at the county fairs. This was what to expect when you're expecting a teen with Mary Ann, and she always talked about hopes and dreams. And so that was the hopes and dreams there. This was one of the retreats. Bill Browning was one of our chairs. This was Let's Talk About Race when we were at the Career Center. This was Arlington All In, some of our volunteers, Marion. This was a different retreat. I can't remember which one, but Katie Crystal was there. We did a lot of different community conversations, so I thought I'd throw those in there just because they were important. This one was the one on SROs. This was the retreat where we did our colors. This was the SRO event. This is Let's Talk About Race at the that looked like a career center. This was one year when we did the relay where we were overnight. And I put that one in there specifically because I was hoping Kateri would be here. But that was this is Let's Talk About. We did one on drugs and alcohol, but we also did a whole bunch on mental health. This was Let's Talk About Race at HB. This is one of the first, I think, Let's Talk About Race events. The school resource officers and you at the library. More pinwheels, a different year, because we did that for quite a few years in a row. This was at one of the retreats where I finally was able to corral everybody into a picture. Let's talk about touchy topics. We did those a couple of times. This is the DHS crew doing a stigma ribbon. I can't believe how many times we got ribbons. That was a good picture from All In. I don't think Sheila's still on the call, but Sheila was one of our chairs. Just Moran, she was our spirit of community. Awesome team. We had a retreat that we were out on the water. Sticker Shock with the teens was always fun, going around to different spots and really being able to connect with the teens and their programs. This was from one of our retreats, but it was interesting to look at that performance model. This was one of the events that we went to that we would ask about how do you build assets and trying to get people to engage with us in different ways. This is the teens doing Mythbusters, and I loved going to the schools. I blew this up one year for the county fair, and it just was a little bit about what we do, and this is us. So thank you everybody for indulging me in that. Some fun memories over the years. I've got probably 3,000 pictures. So if anybody wants them, you can view them anytime. And it has been an honor to be here with you all.
Thank you, Kim. That was wonderful. It's beautiful to see those. Super fun.
It reminds me when I was looking through all of them, it's like, oh my gosh, that's right, we did that. Oh, I remember that. And, you know, seeing all of the different chairs and the different things that we've worked on and being able to provide a lot of pictures. I used to help Tabitha and Lynn and Jamie do some videos and shows and things for CFSD. And so I have all of those as well. So it's just amazing when you look at a photo montage like that of all of the really interesting things that we have been a part of. And I don't have pictures from before then, but if you saw a picture that you want a copy of, I will be happy to share it with you because there are a few.
All those teens are either in a graduate program or in the workforce now.
Yeah, or coming back and joining us, right?
Yeah, coming back and joining, exactly what we want them to do. Absolutely.
Exactly.
Yeah, it's amazing. Thank you, Kim, for sharing.
All right. All right. Well,
all right, boss.
Anybody? I thought I heard somebody say something, but
I just said thanks for everything. It was just a real pleasure working with you.
Yeah.
All these years, both as a partnership member and as the coordinator.
Yep.
Great.
I was a member for about 2 years before I was the coordinator. So
I know we all got together and said, we need a new coordinator. Who should it be? And we all said him.
I know it's yours and Barbara's fault. All right. Good night, everybody. Have a lovely, lovely evening. And I will continue to work with you in various other ways. So thank you very much.
Thank you.
Good night. Thank you.